Welcome to Alberta Rheumatology's discussion on lupus and pregnancy. Lupus is an autoimmune disease that can affect a variety of organs in the body. It's more common in women than in men and often affects women in their childbearing years. For a more general overview of lupus, you should check out our video on our YouTube channel. When it comes to lupus and pregnancy, lupus has no direct effect on pregnancy, and pregnancy has no direct effect on lupus. However, prior to becoming pregnant, there are a few things to keep in mind. It's strongly recommended to have lupus under good control for at least 6 months before becoming pregnant. This can reduce the risk of a lupus flare during pregnancy, which reduces the risk of needing medications. You should review with your physician or rheumatologist if you're planning a pregnancy to figure out what's best for you. It's also important to know your antibody profile. Certain antibodies associated with lupus can increase your risk of certain problems during pregnancy that may not be a problem otherwise. There are certain antibodies that we focus on specifically. Antiphospholipid antibodies can increase the risk of blood clots, and this can lead to a miscarriage in early pregnancy. Some physicians will actually consider checking for these antibodies in women who have had a prior miscarriage. Treatment may be able to reduce the risk of a miscarriage if these antibodies are found. There are also anti-Ro or anti-LA antibodies that normally have no effect on patients with lupus. However, they can cause two concerns in pregnancy. Neonatal lupus is a reversible form of lupus in babies that most commonly presents as a rash. This is due to the transfer of antibodies from mom to baby through the placenta, and it should clear over a few months as the antibodies leave the body and the lupus goes with it. There's also something called neonatal heart block, which affects the electrical activity of the heart and should be carefully monitored. Medication can be provided if there's any sign of heart block to limit its effect. When using medications in pregnancy, it's important to consider the balance between the risk of having a lupus flare off of medication versus the risk of taking the medication itself, and this should be something that you discuss with your doctor. In general, there are medications that we consider safe in pregnancy, such as low-dose prednisone, hydroxychloroquine, and azathioprine, and medications that we consider not safe, such as methotrexate, mycophenolate, and cyclophosphamide. These not safe medications should be stopped at least 3 months in advance of pregnancy. For most women with lupus, a safe and healthy pregnancy is common and very achievable. For more information, please visit our website at albertarheumatology.com or discuss further with your doctor.